So, tonight we're pulling back the curtain on England's missing nurses. Our FactCheck team can exclusively reveal that a third of acute hospitals in England are chronically missing the nurses they've planned for. And we're seeing big gaps in neonatal and intensive care. After a 10-month battle, we've obtained NHS data that hasn't been published for 6 years. Here's how it works. The NHS has a system to calculate each ward's planned nurses. That's usually based on the expected number of patients and their sickness levels. And from this, we'll get the so-called nurse fill rate. Let's imagine that this system says you should plan to have 10 nurses on shift. Well, we can now reveal how many nurses, including temporary ones, were actually working. Imagine that there are only 9 nurses on shift, so they're missing 1 in 10 nurses. Hospital documents describe this kind of gap as a cause for concern and a moderate risk, and yet we've found that a third of hospitals are consistently missing at least this many nurses across all their wards on average over nearly 2 years. We're talking here, remember, about a third of the more than 200 acute hospitals where the most urgent treatment happens. So now let's look at certain types of wards. Here we can see even bigger gaps between planned and actual nursing. We should say the figures don't include other types of care staff. So in critical care, the NHS commissions hospitals to provide a certain number of beds, and this is the basis for their planned nurses. Yet we've found half of England's critical care wards are regularly missing at least 1 in 10 of those planned for nurses. In many cases, care will be covered by other staff. Now, neonatal wards treating the most vulnerable babies in the country, half of these are missing 1 nurse for every 10 they planned for. And a third of neonatal wards are missing at least 2 in 10 planned nurses. We've even found individual critical care and neonatal units at major English hospitals which are consistently missing 3 in 10 of the nurses they planned for. Now, NHS England told us safe staffing is a priority and that nurse and midwife numbers are at an all-time high, but they accept that there is more to do. And they said NHS trusts should ensure suitable nursing and midwifery expertise is in place at all times. The Department of Health and Social Care told us in the summer they'll unveil a workforce plan to ensure the right staff are in the right place and patients get the care they deserve.